There's a sound I'll never forget. The quiet drip of an IV bag beside a hospital bed, the steady rhythm of a heart monitor, and a patient whispering, "Doctor, I wish I'd known sooner." That patient was Martha, a retired teacher in her 70s, who thought her fatigue was just old age. But hidden in her urine test was a silent warning. Proteinuria, the early whisper of kidney distress. I'm Dr. Brian, and welcome to Channel Vital Science for Seniors. If you're over 50, your kidneys have worked millions of cycles to keep you alive. But over time, pressure, sugar, and inflammation can wear them down. The good news is that nature offers gentle allies that can help protect and even heal your kidneys. Stay with me as we explore 7 natural oils that science and centuries of wisdom suggest may restore balance, reduce proteinuria, and rekindle hope. When Martha left the hospital, she made one small promise to herself: to treat her body with gentleness. Her first step wasn't a pill, it was a spoonful of coconut oil stirred into her morning oatmeal. At first it seemed too simple, but behind that silky texture is real biochemistry, nature's quiet brilliance at work. Coconut oil is rich in something called medium-chain triglycerides, or MCTs. Think of them as the express lane fats. They're digested quickly, providing energy without burdening your kidneys with heavy metabolic waste. In a body already struggling to manage high creatinine or the effects of a long battle with diabetes, that lighter load makes a difference. But there's more. Inflammation is the hidden villain in almost every kidney problem. Imagine your kidneys as 2 garden filters. When they're swollen, they can't separate clean water from debris. Coconut oil's natural anti-inflammatory compounds help soothe those swollen filters, allowing them to heal. Its antimicrobial effects, too, may help protect the urinary tract from infection, another stressor that can worsen proteinuria. Some studies, including one published in the Journal of Nephrology Therapeutics, suggest that MCTs support healthy lipid metabolism, which in turn stabilizes blood pressure, a key player in kidney decline. That means less strain, fewer leaks of protein, and a calmer internal environment. I often tell my patients, you don't need a drastic overhaul. Small daily rituals matter most. 1 to 2 tablespoons of virgin or extra virgin coconut oil can replace butter or processed oils in cooking. You can drizzle it over vegetables or blend it into coffee for a creamy texture that feels indulgent but healing. Martha did, and 3 months later, her lab results and her energy began to change. Not magic, but metabolism meeting mercy. When I first met Harold, a retired engineer with a slow, thoughtful way of speaking, he confessed that he'd stopped fishing years ago because it felt like too much effort. What he didn't realize was that the fish he used to catch held something that could help his kidneys and his heart far more than he imagined. Fish oil derived from fatty fish like salmon, sardines, and tuna is one of the most powerful natural sources of omega-3 fatty acids, known as EPA and DHA. Think of these omega-3s as peacekeepers inside your body. Where inflammation causes chaos, tightening blood vessels, raising blood pressure, and scarring kidney filters, omega-3s restore calm. They help your kidneys filter waste more smoothly, reduce protein leakage in the urine, and improve the flow of blood through those delicate vessels. Several studies, including one from Kidney International, have shown that patients with IgA nephropathy, a condition marked by proteinuria, experience lower protein levels and slower disease progression when taking fish oil supplements regularly. For Harold, who had both high blood pressure and mild kidney impairment, that mattered deeply. His goal wasn't just to lower his lab numbers, it was to walk to the park again without feeling winded. Within months of eating salmon twice a week and adding a purified fish oil capsule each morning, his blood pressure eased and his energy returned. Fish oil doesn't just protect the kidneys, it strengthens the entire cardiovascular network they depend on. When your blood vessels relax, your kidneys can breathe. For those managing high creatinine or following a careful diet for kidney disease, fish oil offers a safe, nourishing complement. Always choose a high-quality, tested supplement, free from mercury and contaminants. And as I tell all my patients, before starting any supplement, have a conversation with your doctor. Your kidneys deserve that respect. A few years ago, I met Lena, a retired nurse who had spent her career caring for others, but had grown weary caring for herself. Her blood work showed elevated protein in her urine and creeping creatinine levels. When we spoke about natural support, she smiled faintly and said, "My grandmother used to swear by black seed oil." She was right to remember. This ancient remedy, pressed from Nigella sativa seeds, has been used for centuries, and modern science is beginning to understand why. Inside each drop of black seed oil lies a compound called thymoquinone, a potent antioxidant and anti-inflammatory agent. If inflammation is the fire that damages your kidneys, thymoquinone is the cool, healing rain. It helps quiet immune overactivity, reducing the scarring and leakage that cause protein to spill into urine. Studies, including one published in the Journal of Endocrinology and Metabolism, suggest that black seed oil can reduce oxidative stress and protect kidney tissue from toxins. A remarkable finding for such a humble plant. Lena started small, just 1 teaspoon of black seed oil mixed with honey each morning. Within a few weeks, her blood pressure steadied and her morning swelling eased. She wasn't cured, but her body was calmer, her energy steadier. That's the beauty of natural healing. It works with your rhythm, not against it. I like to explain it this way. Your kidneys are like the filters in a fish pond. If the filters are inflamed, the water turns cloudy. Black seed oil doesn't replace the filter. It helps restore its natural clarity. You can drizzle it on salads, blend it into smoothies, or simply take it straight if you prefer. The key is consistency and choosing high-quality, pure oil. And as always, consult your physician before adding it to your daily care. Nature's gifts work best alongside medical wisdom. Not long ago, I spoke with Arthur, a retired postal worker who developed stage 2 kidney disease after years of battling high blood pressure. He felt tired, puffy, and disheartened. "Doc," he said, "I've lost my spark." When I suggested hemp seed oil, he looked surprised. He thought it was the same as marijuana. It isn't. Hemp seed oil is pressed from the seeds of the hemp plant and contains no THC, no psychoactive effects, only nourishment. What it does contain is a rare balance of omega-3 and omega-6 fatty acids, including gamma-linolenic acid, or GLA. Imagine your kidneys as 2 intricate webs of capillaries, delicate but resilient. Over time, inflammation and poor circulation can stiffen those threads, making filtration sluggish. Hemp seed oil helps relax those fibers again. Its healthy fats reduce inflammation, improve blood flow, and support the repair of kidney tissue at a cellular level. Studies from journals such as Nutrition and Metabolism highlight hemp seed oil's potential to lower blood pressure and decrease oxidative stress, 2 critical factors for protecting kidney health. When Arthur added 1 tablespoon of cold-pressed hemp seed oil to his breakfast smoothie, he noticed a difference within a month. His morning stiffness lessened and his blood pressure readings began to drift down. It wasn't a miracle. It was biology responding to balance. By improving circulation and calming inflammation, his kidneys could focus on what they were designed to do, filtering waste, not fighting constant damage. Hemp seed oil has a pleasant, nutty flavor that blends easily into foods. Drizzle it over vegetables, mix it into dips, or take it directly if you prefer. The key is choosing a pure, cold-pressed brand, free of additives. And always remember, even natural oils should complement, not replace, your prescribed treatment. Arthur's spark came back because he paired science with self-kindness. When Evelyn, a 68-year-old grandmother and gardener, came to see me, she brought a jar of roasted pumpkin seeds in her purse. "Doctor," she laughed, "I've been eating these since I was a girl. Are they really as good as people say?" I smiled and told her, "Even better if you know how to use them." Those humble seeds, when pressed into oil, create a dark green liquid rich in vitamins, carotenoids, and essential fatty acids, a true elixir for tired kidneys. Pumpkin seed oil works quietly, like a patient gardener tending dry soil. Its antioxidants, particularly vitamin E and carotenoids, neutralize the free radicals that attack kidney cells day after day. Its phytosterols improve urinary flow and may even calm an overworked bladder, reducing nighttime trips that steal sleep. A 2019 study in the Journal of Medicinal Food found that regular consumption of pumpkin seed oil helped lower urinary protein levels and improved overall renal markers in adults with mild kidney disease. That's science catching up to folk wisdom. When Evelyn began adding a teaspoon of this oil to her morning salad dressing, she noticed subtle changes, less swelling in her ankles, steadier energy, and a warmth returning to her complexion. She wasn't chasing perfection, just giving her kidneys room to breathe again. The healthy fats in pumpkin seed oil support the cell membranes of those vital filters, allowing better repair and smoother function. I often describe it this way. Your kidneys are like musical instruments. They play best when finely tuned. Pumpkin seed oil is part of that gentle tuning. Nothing dramatic, just steady harmony over time. 1 to 3 teaspoons a day, unheated, is enough. Keep it in a cool, dark place and treat it as food, not medicine. Nature's orchestra works best when every note, including your choices, stays balanced. I'll never forget Samuel, a 72-year-old retired mechanic whose hands still bore the strength of a lifetime's work. He came to me worried about his kidneys after a routine check showed elevated creatinine and traces of protein in his urine. "Doc," he said, "I've fixed engines all my life, but I can't seem to fix this." I smiled gently and told him, "Maybe it's time to give your body the right kind of oil." Flaxseed oil is one of nature's purest sources of omega-3 fatty acids, specifically alpha-linolenic acid, or ALA. Think of your kidneys as filters made of countless fine threads. Over time, inflammation can tangle those threads, making filtration sluggish and rough. ALA works like a soothing lubricant, untangling the knots and restoring smoother flow. It also contains lignans, plant compounds that act as antioxidants, shielding kidney tissue from oxidative damage, the same way oil prevents rust in an old engine. Scientific studies, including research from the American Journal of Physiology, have shown that diets rich in flaxseed can reduce oxidative stress and improve kidney function, particularly in people with hypertension or diabetes. Samuel began taking 1 tablespoon of cold-pressed flax seed oil each morning in his oatmeal. Within weeks, his morning stiffness eased, and his lab results showed gentle improvement. Small but steady. He laughed one day and said, "I guess I just needed a tune-up." Flaxseed oil has a mild, nutty flavor that blends easily into smoothies or yogurt. It should never be heated, as heat destroys its delicate omega-3s. Keep it refrigerated and use it fresh. This simple habit helps reduce inflammation, supports heart health, and may protect kidneys from further scarring. Small steps, repeated daily, can restore more than organs. They restore confidence and calm. There's something timeless about olive oil. It's been called liquid gold since the days of Hippocrates, and for good reason. When I think of kidney health, I often think of Maria, a 75-year-old artist who had spent years painting landscapes in the Mediterranean sun. She moved to the U.S. later in life, trading her olive groves for city lights. And slowly, her health began to falter. Her creatinine crept up, her blood pressure rose, and fatigue settled in like a shadow. When she came to me, I asked her gently, "Maria, have you kept olive oil in your kitchen?" She laughed softly. "Of course, doctor. It's in my veins." And perhaps that's why her recovery came so naturally. Olive oil, especially extra virgin and cold-pressed, is rich in monounsaturated fats and powerful antioxidants known as polyphenols. These compounds calm inflammation throughout the body, including the small, fragile vessels of the kidneys. Think of it as cooling the embers that quietly burn your filters from the inside out. When inflammation cools, your kidneys can refocus on their delicate work, cleansing, balancing, and renewing. Research from the Clinical Nutrition Journal found that regular consumption of olive oil supports better kidney function and cardiovascular health, helping to reduce protein leakage in urine, a hallmark of proteinuria. The heart and kidneys are partners after all. When one thrives, the other follows. Maria returned to her roots, 2 tablespoons of extra virgin olive oil a day, drizzled over vegetables and soups, never fried or overheated. Within months, her energy lifted, her blood pressure steadied, and her lab markers improved. She once told me, "Doctor, it feels like my body remembered where it came from." That's what olive oil does. It reminds your body how to live in balance again, gracefully as nature intended. So, my friend, if there's one message I hope you carry from this, it's that your kidneys are not beyond hope. Even when lab numbers rise and fear creeps in, there are still gentle, natural ways to support healing. The 7 oils we've explored, from coconut to olive, are not magic bullets, but faithful allies. Pair them with a kidney-friendly diet, movement, and regular medical care, and your body can surprise you with its resilience. Always consult your healthcare provider before adding new oils or supplements. And remember, healing isn't just possible, it's your birthright. Stay hopeful, stay curious,